Okay, so now it is time for discussing about the symptoms. Okay, so before going to start this video, I would like to recommend you to please go back and watch my previous videos if you are new in this channel, or if you don't know about the how Haemophilus influenza causes infection and what kind of disease it causes. Okay, then I would like to recommend you to please and go and visit the previous videos of the lecture series of Haemophilus influenza. Okay, then it will help you to understand about the symptoms. Okay, and those who have already watched those videos, so I would like to request them to try to recapitulate what I have taught them. Okay, so first of all, the important thing that I have told you in the very first video lecture of Haemophilus influenza, that is, there are two type of strain that is in our concern. One is Haemophilus influenza type B, another one is non-encapsulated strain, right? So these two are responsible for causing symptoms. Okay, so now let's try to remember about what I have told you in my, I think, third video lecture. Yes, third video lecture. So there I have told you that Haemophilus influenza type B, as it is a encapsulated bacteria, it have the ability to cause invasive disease. Okay, that means in that part you can observe epiglottitis, along with you can observe cellulitis, along with you can observe bacteremia, along with you can observe meningitis, along with you observe osteomyelitis, along with you can also observe septic arthritis. Okay, so in this video we will going to discuss about the symptom associated with those medical conditions. Okay, so now first thing, epiglottitis. So try to remember what I have told you, that from nasopharyngeal area the Haemophilus influenza travel to the epiglottis and causing this infection, right? That is epiglottitis. So remember it, that epiglottitis is a complication of throat. Okay, that means you can observe fever. And another important thing, that make it very clearly, that whenever you are there is a foreign pathogen in your body, your immune system gets activated. Okay, and as a result there is a generation of heat. Okay, so you can observe the symptoms of fever in almost every kind of disease. Okay, so this is the advantage. So whenever you you do not able to remember about any symptoms, you can just write the fever. Okay, there are 99% cases where you will succeed. Okay, so now, by the way, so in epiglottitis the symptoms associated are fever along with sore throat. I have told you it is a throat related condition, along with difficulty speaking. So you are having an infection in throat, so that is obvious that you will have difficulties in speaking, along with dyspnea. Okay, so that is the epiglottitis. So fever, sore throat, difficulty speaking and dyspnea. Okay, so now similarly meningitis. Meningitis is a condition associated with brain. Remember it very clearly. Okay, so fever as usual, along with you can observe irritability, along with you can observe altered mental conditions. Okay, also called, you can write about altered mental status, along with sore neck, lethargy, vomiting. Okay, so these two parts we have discussed, that epiglottitis help us. The symptoms associated with epiglottitis are fever, along with fever we can observe sore throat, along with sore throat you can also observe difficulty speaking and dyspnea. Okay, and in meningitis part we can observe fever, along with fever lethargy, along with lethargy we can observe irritability and vomiting, along with the sore neck, along with altered mental status. Okay, so now let's talk about cellulitis. So try to remember that I have told you that Haemophilus influenza can also migrate to the soft skin tissues of the faces and causes this complication named cellulitis. Okay, so the symptoms include fever and warm tender area of erythema on the cheek or periorbital areas. Okay, you can, and I have also told you that from epithelial cells of nasopharyngeal, it is also possible that they breach out and invade the blood capillaries. Okay, where that means it will enter the blood, and whenever a bacteria enters inside the blood, it is caused as bacteremia, right? So symptoms of bacteremia include fever, chills, hypotension and tachycardia. Okay, so now septic arthritis. So remember it that it is a complication of joint. Okay, so you may observe fever, pain, swelling and tenderness in the affected joint. Okay, so now last one, that is osteomyelitis. It includes fever, bone pain and weakness. Okay, so that is all the symptoms that you have to remember under Haemophilus influenza type B. Okay, so let's try to understand that Haemophilus influenza type B, from the nasopharyngeal part first go to the epiglottis, right, and causing epiglottitis. Okay, so symptoms include fever, sore throat, difficulty speaking and dyspnea. Okay, and your Haemophilus influenza from nasopharynx can also go to the soft skin tissue, okay, of faces and can cause cellulitis. Okay, the symptoms include fever, warm tender area of erythema on face, and also the symptoms which you can call about periorbital areas. Okay, so from that, another important thing, from epithelial layer or epithelial cells of nasopharyngeal, it is also possible that they can breach out and enter the bloodstream. Okay, and this condition is known as bacteremia condition, which facilitates symptoms such as fever, then chills, then our hypotension along with tachycardia. Okay, now from the blood, it is obvious that it can go to any part of the body. So it can go mainly towards meninges and causes meningitis. Okay, and I have told you that meningitis is a brain infection, right? So it can cause fever, lethargy, irritability along with altered mental status along with vomiting. Okay, so now along with meningitis, it can also go to the our joint, okay, and causes septic arthritis. Okay, so the symptoms include fever, pain, swelling and tenderness in the affected joint. Okay, it can also cause osteomyelitis by traveling towards the bone. Okay, which symptoms include fever, bone pain and weakness. Okay, so that's how you can easily remember about the symptoms of the Haemophilus influenza B. Okay, although you don't have to remember about each and everything, you can only remember about 2 or 3 from each of the part. Okay, now let's come here. So another important species is Haemophilus influenza non-typeable. So again, try to remember what I have taught you in my third video lecture, that is non-typeable Haemophilus influenza only causes mucosal infection by direct extension, right? It cannot cause any kind of invasive disease. Okay, so first thing that it can cause is the otitis media by going up to eustachian tube and then from there towards the middle ear. Okay, so otitis media, remember it very very carefully that it is a ear infection. Okay, so fever along with you can get ear pain along with otorrhea, which is a condition where you can get discharge in ear. Okay, now sinusitis, we have also discussed that this kind of Haemophilus influenza can also travel to the paraneural sinuses and causes sinusitis, right? So Here you can observe fever, along with you can observe tenderness in the affected sinus, okay, along with persistent purulent nasal secretion or nasal discharge, okay, persistent purulent nasal discharge. So that is about sinusitis. And remember it, try to remember that I have told you in the lecture where I have discussed the risk factor associated with non-typable strain of Haemophilus influenza. There I have told you the people with chronic obstructive pulmonary disease or cystic fibrosis can develop bronchopneumonia also, okay. So these are the symptoms that they can have. So fever, chills, chest pain, short breathing, okay, or shortness of breath, anything you can say, along with cough. Conjunctivitis, which is a complication in eye, that is redness of eye or pain and burning in eye, okay. So that are the symptoms of Haemophilus influenza non-typable strain, okay. So it can affect the ear, causing otitis media, for example, let's say fever along with pain in ear along with otorrhea, that is the discharge in ear. It can also cause sinusitis, okay. This sinusitis is also includes symptoms like fever along with the problem, that is tenderness of the affected sinuses along with persistent purulent nasal discharge, okay. You can also get bronchopneumonia, that is fever along with chest pain along with cough along with short breathing, okay, or shortness of breath, okay. And the last part is conjunctivitis, that is the redness of the eye along with pain and burning of eye. So that is the non-typable influenza strain, okay. And in typable influenza strain, that is our Haemophilus influenza type B, we have seen that it can cause epiglottitis, which includes symptoms like, let's say, fever along with difficulty in speaking, dyspnea along with sore throat, right, and also meningitis, right, which is which includes symptoms like fever along with, it can include the irritability along with it can include, let's say, the alteration in the mental status, etc., right. Along with you can also get cellulitis, that is the condition where you can get fever along with warm warm tender like area of erythema on cheek or periorbital area, right. That is a type of redness in the skin, erythema is the situation where you can get a type of redness, that is why warm tender area of erythema, okay, or the periorbital area. So after cellulitis you can also get osteomyelitis, okay. So this osteomyelitis is the problem in bone, okay, that include pain, mainly bone pain along with weakness, okay. And septic arthritis, that is the complication in joint, okay. This include fever, pain, swelling, and the last one and very important one, that is the tenderness in the area of affected joint, okay. So that is the concept of symptoms of Haemophilus influenza, and I have also discussed with you that how can you remember about this very clearly. So that's it for today, friends. So I hope this video will be helpful to you to understand the symptoms of Haemophilus influenza. So we will again come back with the diagnosis in our upcoming videos. So till then, bye bye.